The views, thoughts, and opinions expressed in this episode are that of the guest and host and do not necessarily reflect the values of sponsors or other associated organizations. Welcome to the Parental Compass, presented by Family Education and Support Services. I am your host, Bobby Williams. I want to start by thanking all the people who have been encouraging us and listening to the show every week. We're starting to build a little following, so it's cool to see. You can be one of those people by subscribing to us on Apple or Spotify, or go to parentalcompass.org. We, of course, have to thank Molina Healthcare for sponsoring the show through their Molina Cares program, building stronger communities one life at a time. I have worked with Molina for years. They've sponsored my organization, the Bridge Music Project. They have worked with a lot of organizations in the community, and they're just a true pillar out here. So thank you, Molina. We appreciate you. Today we are talking about ADHD. This issue is very personal to me because it's something that I've dealt with my entire life. We are talking to the foremost authority, at least out here. We're talking to Dr. Holttum. What I appreciate about Dr. Holttum is he's not just some pill pusher or something. You know, he really looks at the whole person when he's making his treatment plans. I've taken kids that I've worked with to see him for years, and I've always been very impressed. So let's give it a listen. Well, and it just seems like the ADHD rates keep going up over the years. Or why do you think that is? Do you think it's just Big Pharma trying to sell us all some Adderall? Or why is that?
Well, I have comments about Big Pharma trying to sell Adderall, but I think it's been reasonably stable during my career. So the 30 years that I've been doing child psychiatry, it's probably gone from national average around 6 or 7% to 8 to 10%. Mm-hmm. But you'll see pockets throughout the country, sometimes based on just an individual's practice or a pediatrician's practice, where there'll be 15, 20% of the kids in that area are diagnosed and on medication. But nationally, it's only gone up, maybe from 6 to 10%.
Yeah. Do you feel like it's underdiagnosed or overdiagnosed, or it's about where it should be?
Well, just based on my experience, I think it's both. My experience with ADHD is slightly skewed because I see kids after they've seen their primary care doctor and they get referred to me. So most of the kids I'm seeing, it's not straightforward and simple. So given that caveat, I see a lot of kids who are misdiagnosed with ADHD. Really every diagnosis in the DSM affects attention span for kids. If they have trauma, then they can't focus well, and they also can't remember well. If they have OCD, their brain is full of intrusive thoughts, and there's no room for focusing on schoolwork. Any anxiety disorder, any depressive disorders can affect attention. And since their job is to go to school, attention span and lack of follow through at school may be the first thing that's noticed. So the overdiagnosis, I think, comes from focus complaints. The school says the kid's not keeping up at school, they're not paying attention, they're distractible. Family takes the kid to the pediatrician, who gives them an ADHD rating scale. The ADHD rating scale only asks you ADHD questions. It doesn't ask you about depression or trauma or anything else. And then, the kid gets on medication for focus. That overdiagnosis trend is enhanced by the fact that you don't have to have ADHD to benefit from stimulants. And that's why Starbucks is a multi-billion-dollar business. Stimulants make people focus no matter what the underlying problem is, lack of sleep or anything. It's not the primary problem in a lot of the kids that I see. Now, on the other side of the coin, it's underdiagnosed in bright kids. High IQ kids will often skate through elementary school. They understand things intuitively. They do well on tests. may not get all their assignments in, but their grades are good until they get to, middle school or high school, where the demand goes up. There's a lot more discipline and work ethic required. And then you start seeing the inattention.
Mm.
It's also underdiagnosed in girls. That's pretty well studied because they tend not to show the behavioral aspects that produce early complaints from teachers.
Yeah, it's like when you're becoming a problem for the classroom, it's sort of squeaky wheel gets the grease kind of thing.
Exactly. I recently evaluated a young woman who's transitioning into college, clearly has had ADHD her entire life, but so bright that she skated through everything until that senior year of high school, where things just where there was just too much for her to keep up with. And a little bit of stimulant to help focus did wonders.
Mm. So I want to talk about the medicine in a second, but first, just getting down to real basics. What is ADHD, or how do you define it? Because we hear a lot about it, but it's probably more specific than a lot of people think, I'd assume.
Neurologically, it's an underperformance of the prefrontal cortex. So
Mm.
the area of the brain that's right above your eyes is responsible for executive function. And if the activity or tone there is low, then it's difficult to pay attention. And there's been a couple of functional brain image studies showing that when kids with ADHD attempt to focus on something, activity in that part of the brain actually reduces, where the normal response is the activity will increase on demand.
Yeah. So everyone is on some sort of spectrum of this, right?
My my explanation to patients that I find most useful is to make a distinction between ADHD and what we usually think of as disease.
Mm.
So I have diabetes because my pancreas doesn't work. Someone with schizophrenia has a problem with the receptors in their brain that modulate dopamine and other things. In both of those cases, we're talking about something that's not working right. It's broken. That's not the case with ADHD. If we were to measure everyone's attention span and plot it, it would form a nice normal curve, just like measuring everybody's height would form a nice normal curve. And the bottom 5 to 10% of that curve, the people with the shortest attention span and most difficulty with executive function, they're not really built for school. Those people really struggle to sit in a seat quietly for 6 hours a day for 12 years of their life. So it's not so much a disease as just kind of the tail end of the normal curve, which is handicapped for function in our school structure.
Mm. Well, it's nice to know my brain's not broken, you know? Um, well, so I do want to talk about the medicine. It seems like it's a very controversial issue. People are like, well, it's low grade meth. And, I'll be open. Like when I was a teenager, I was prescribed Adderall and took it. And it did really help me focus, but it also was kind of fun when I was like first taking it, or it's like, I'm in a great mood.
People do grind up and snort Adderall. That type of entry produces a bigger spike. And how abusable a stimulant is really depends on how much it stimulates the pleasure center in the brain. That's very low when you take therapeutic doses orally, and gets very high when you do things like snort or use IV, or in the case of meth, it's a more potent stimulant. So it's more likely to press that center. There is actually an oral form of methamphetamine that you can prescribe for ADHD. I don't, just because it makes me uncomfortable, but it exists. And taken orally, people don't report that buzz or high. Crushed up and snorted, they do.
Mm. Do you think are they developing these drugs to make them different, or I'm wondering if someday we'll look back on this like how we look at doctors in the 1860s prescribing coke or something. Like, are they doing things to improve the medicines?
There hasn't really been a new stimulant in decades. We've got basically methylphenidate and dextroamphetamine or dexedrine, and we've got those packaged in about a dozen different ways for different delivery systems.
Yeah.
The main advancement to reduce abuse is the delivery system. So one of the most popular forms of methylphenidate is Concerta. And Concerta is basically a small plastic device that osmotically squirts the medicine out slowly over about 6 hours. That makes it really hard to abuse. You'd have to cut it up, and you end up with a gel mass that can't be snorted. It can only deliver its medicine slowly over time.
Yeah.
On
Well,
the Adderall side, there's Vyvanse, which is a prodrug. So it's basically Adderall with an amino acid on it that also releases very slowly over time.
yeah. Well, okay, so this is working for the majority of people. How can you tell if the medicine is working? Say you have a child who has ADHD. What are the signs that this is a success versus we need to adjust?
Well, my style is to use the most important outcome, which is productivity. So we have ADHD rating scales that are standardized for the classroom setting. So you've got a classroom where there's social and rule-based expectations for staying in one seat and staying focused and that sort of thing. That's the most repeatable, reliable place to rate the symptoms. So we start with teacher rating scales, and when those improve, then we know that we're making progress. But ultimately, I want to see that the child is actually keeping up on their work and getting everything done and getting the grades that they're capable of getting.
I remember being young and having so many challenges in school and just feeling like a lot of shame, like, oh, I guess I'm just not that smart of a person. But I imagine a lot of kids with ADD or ADHD have that kind of shame.
Yeah, and it manifests in different ways. There's a relatively new concept. It's not a diagnosis, but it's a clinical concept called rejection sensitivity dysphoria,
Mhm.
which in essence is the end product of always being in trouble. So if you spend your entire childhood up through elementary school feeling like no matter how hard I try, I'm always going to mess up. Parents are going to be mad at me. Teachers are going to be mad at me. I'm going to get bad grades. I'm going to fall short of what other kids are doing. Then you start to expect that. You start to expect that everything you do is going to be wrong. And eventually you stop trying and become kind of hypersensitive to being pushed into doing things where mistakes could happen.
Mhm.
And that's part of the treatment, is to educate the kid that no, there's nothing wrong with your brain. There's something wrong with our school system. You would be much better suited, learning in an active way with a lot of body movement and experientially. That's just not the way our schools work. So we're giving you this medicine as a pair of glasses for your brain. I compare it to short-sightedness. If you can't see more than 10 feet in front of you, it's going to be really hard to read the board in class, and you're going to be at a disadvantage. Well, if you can't pay attention more than 30 seconds, then you're at a disadvantage in class, and this medication is like a pair of glasses for your brain.
Yeah, it's a shame that school is such a one size fits all type situation.
Yeah.
Hopefully, it'll change over time.
Yeah, I don't know. It's
It's been like
I don't
that for a
I don't
while.
have any. Pardon me.
It's been like that for a while, I guess, too.
Yes, I
Uh,
see the trend going the other way, getting like more one size fits all, with pressure to improve performance. I don't know why, because if we kind of compare ourselves to other countries that perform better in academics, and those other countries have much more flexible schedules. They have kids playing in kindergarten, not doing homework, and they have multiple tracks that kids can follow based on their aptitude, not necessarily a one size fits all.
Other than the medicine, are there other ways that you can support children with ADHD?
Well, a lot of it is educating parents. And I have to say that that process involves a family history because, ADHD tends to run in families. So there's a good chance that the parent of the ADHD child that I'm treating also has a short attention span and is impulsive.
Mhm.
So trying to structure the entire household, get everybody on a schedule, everybody using reminders and lists and organization tricks, can be really helpful. There's a few books about that. Ned Hollowell wrote a whole series called Driven to Distraction, and then he applies it to different settings. Lots of nice tips and tricks, and demystifies the whole process of what ADHD is, how to live with it, and also how to turn it to your advantage in some situations.
Yeah, that's what I want to touch on. There's a lot of amazing people that have ADHD. I think of like awesome rappers like Joyner Lucas. And so it inhibits you at school, but there are some positive sides to ADHD, right?
For sure. The career path for my clients with ADHD, I always try to steer a little bit towards the creative, because people with short attention span tend to be very good multitaskers. They don't mind being interrupted. They're interrupting themselves every few seconds anyway. And they're good at, juggling, at keeping multiple tasks in the air at once, especially after their brain matures a little bit. I use the example of my late wife, who was an artist with really bad ADHD. So she had a hard time, going to town and filling a grocery list, because she would end up being distracted and going multiple places. She had medication to help with that kind of stuff, and also to help in college. But to create art, to do her painting, she couldn't take the medication because she thought too rigidly and like over-planned things instead of just letting it flow. And I've seen the same thing with musicians, public relations people. Any kind of creative multitasking career tends to benefit from being a little ADHD.
Yeah, you can be more entrepreneurial sometimes.
Yeah. Impulsiveness can be good, and inhibition, overthinking, bad in certain situations.
That's cool to know there's at least a positive side to it sometimes. It's not just totally negative. What would you say to a parent who suspects their child has ADHD, or they've been diagnosed with ADHD, and they're just feeling nervous about the child's future, general anxiety about it? What would you say to that parent?
Well, the first thing is to get some help and get some perspective. I would go in armed with the knowledge that medication is not the only answer. And even if medication is the answer, stimulants are not the only medication. But it can never hurt to have the child understand how their brain works. Even if all you get is a good diagnostic workup, well, what you've done is you've eliminated the possibility that there's another problem like depression or anxiety that's manifesting as inattention. You also have access to a whole lot of tricks and tips on how to manage your life with a short attention span. And at least you know what the options are for intervention. What I also tell parents is that this is thought of as a disorder of childhood. And the reason it's thought of as a disorder of childhood is not because ADHD goes away in adulthood. It's because the prefrontal cortex that we spoke of before continues maturing all the way up to about age 25 and 26. So having ADHD makes a bigger impact in the school years, because that's a boring time of life where you have to sit in class for 6 hours a day and be polite and quiet and study. Once you get to adulthood, hopefully the child gets to choose something that's more suited for them. That part of their brain is mature, so the difference in attention span is not as big as it was back in childhood. So really, it's not bad news. It's just getting to know oneself and having a lot more information to plan your future.
Well, Dr. Holttum, I greatly appreciate that, and thank you for coming on today.
My pleasure.
Thank you, Dr. Holttum. Like I said at the beginning, I've been taking kids to see Dr. Holttum for years, and he's always struck me as a very sincere, real person. And this interview just further confirms that. So on behalf of Family Education and Support Services, Molina Healthcare, and myself, Bobby Williams, this has been The Parental Compass. We'll see you next week. Peace.